Welcome to the Holistic Plastic Surgery Show, where we cover the hottest topics in health, beauty, and cosmetic treatments. I'm Dr. Anthony Yoon, America's holistic plastic surgeon. Well, do you want to look better without having to undergo a lot of pain, downtime, and a general anesthesia? Well, if you do, then you're in luck. Minimally invasive procedures are all the rage in plastic surgery today. Now we're able to remove fat, lift necks, reshape the nose, and get rid of saggy eyelid skin with shorter recoveries, smaller scars, and less cost than ever before. Sounds good, right? Well, my next guest is a master at performing these types of lunchtime procedures. Now, these aren't necessarily procedures that are done during your lunch break, but conceivably they could be. They're that easy to have done. And best of all, they don't require going to the hospital, getting a general anesthesia, or even an IV, and you can walk out and even drive yourself home afterwards. So let's get started. My next guest is a double board certified plastic surgeon, certified by both the American Board of Surgery and the American Board of Plastic Surgery. He earned his Doctor of Medicine degree at New York Medical College, then completed a full general surgery residency at Columbia Presbyterian Medical Center in Stamford, Connecticut. He was called to become a plastic surgeon and therefore completed his plastic surgery residency at George Washington University Medical Center. Then he moved to Beverly Hills, California, where he completed an advanced aesthetic surgery fellowship at Beverly Hills Body, where I also went. He went on to co-found Sunset Cosmetic Surgery, one of the premier plastic surgery practices right in the heart of Beverly Hills. My guest is a member of all of the associations that matter in our field. The American Society of Plastic Surgeons, the American Society for Aesthetic Plastic Surgery, the American College of Surgeons, the California Society of Plastic Surgeons, and the International Society for Plastic and Regenerative Surgery. He is a television star, having appearances on Dr. 90210, The View, Dr. Phil, MTV, and VH1. He specializes in precision cosmetic enhancements, including facelifts, fat injections, breast enhancement, body contouring, and cosmetic injections. His practice is in the top 1% of Botox providers in the country. I'd like to welcome one of my best friends, a plastic surgeon to the stars, Dr. Steven Svehlak, to the Holistic Plastic Surgery Show. Well, thanks for coming on the show. Is it all right if I call you Steve? I mean, we're good friends, but...
That's fine. We've known each other for a long time, so I'm fine with that.
So
Can I call you Tony?
Of course, of course. So let's just start by kind of explaining our relationship. I met you back when I finished my residency in plastic surgery, and then I moved out to Beverly Hills to work with a famous plastic surgeon out there. And you had done his fellowship, which is kind of like an apprenticeship, the year before me.
Exactly. I don't know. I started out there early 2002 with the apprenticeship for 6 months. And then I eventually worked in his office, and then eventually I met you a year or two later.
Yeah, so this doctor is Dr. Richard Ellenbogen. He's still in practice now, really good guy, a very successful, famous plastic surgeon. So I'm not sure what your experience was, but for me, going from my training, my residency training in Grand Rapids, Michigan, where we really, it's a fantastic residency program. We did a lot of what we call bread and butter plastic surgeries. So breast reduction, breast reconstruction, facial cosmetic surgery, all types of recon. And then to go to Beverly Hills and work out of a private, successful practice out there, it blew my mind. What was your experience when you went from George Washington, an academic plastic surgery medical center, to working in a private practice in Beverly Hills?
Exactly. Kind of what you said there is just, in my training, it was all about the bread and butter plastic surgery. Reconstruction, I did a lot of children's plastic surgery, also like cleft lip and cleft palate at the Children's Hospital in DC. But when I was finishing up training, I was considering where am I going to go next? I didn't get a whole lot of cosmetic, top end cosmetic training, and I decided I wanted to look for a fellowship. And then I eventually found Dr. Ellenbogen, and he took me by the hand, and it was amazing. He totally accepted me in, and it was a great experience where I stood, side by side working with him, one of the greats, learning all his techniques, all the latest techniques in cosmetic surgery and beauty.
Yeah, and I think one thing I got out of working there for a year in Beverly Hills was really, I think, refining the artistry of plastic surgery and getting the eye for what somebody could benefit from. You know, anybody can come in and say, oh, I want a breast augmentation, I want a tummy tuck, or I want a facelift. But to be able to actually look at somebody and to figure out this procedure is going to be better for them than that procedure. Or if you do this procedure, they're not going to look quite right. That's what I really got from him, which to me was absolutely invaluable.
Yeah, it was amazing. I mean, just to fine tune your skills and learn not only the best techniques for the appropriate patient, but also things what not to do. And so that's what was really important in with my training when I was out here.
Yeah, and I found too that the patients in Beverly Hills were very different than what I saw and see in Michigan. So for example, you know, here where I'm at in Metro Detroit, a lot of my patients are involved in the auto industry. So I see people who are line workers, people who are engineers, I see educators, nurses, doctors. The patients that I saw in Beverly Hills were very different. So for example, one patient I remember very clearly, and this was like 12, 13 years ago, I said, well, what do you do for a living? And she looked like a very quote unquote normal person, very unassuming, not dressed in a different way. And she said, oh, I'm a hand and foot model. So I thought, oh, okay, you know, that I looked at her hands and okay, I can see that. And she goes, but I really make my living selling used women's underwear on eBay. I thought, whoa, people do that? So
they do. I mean, it's a whole different ball game out here.
It really is. So now you've been out there for about 13, 14 years now? Yeah,
it's probably a little bit more than that. I came out late 2001.
Okay, and then you were with Dr. Ellen Bogan for several years, and then you co-founded with Dr. Daniel Yamini, another good friend of ours, fantastic board-certified plastic surgeon. You founded Sunset Cosmetic Surgery, which has now become really one of the premier plastic surgery practices in Beverly Hills. And I tell my patients when they ask me, Dr. Yoon, if you wanted to go back to California, where would you go? And immediately I tell them, look, if I could, I would join Sunset Cosmetic Surgery if they would have me. And I don't know that they would, but if they would.
Well, we got a little extra space if you ever want a little office.
So now, you know, I left about 12, 13 years ago. And how have things changed since then? You know, with the procedures that you're doing, with what people are asking for, I'm sure plastic surgery has evolved over the last dozen or so years. What have you seen?
Oh, for sure. The biggest thing, I guess, when I first came out for training in learning the techniques at the time, it really was all about the surgery. And there wasn't a lot of alternatives besides surgery. And over the years, the industry and the patients have demanded quicker treatments, quicker results, looking better now, not 3 weeks from now, and getting back to work and doing their daily routines. And so a lot of the treatments have been geared toward that. Things such like, you know, everybody's heard of Botox or the fillers like Juvederm and Restylane, all those type of treatments. And they're always something new coming out year after year. And that's kind of where it's gone. There's less and less surgery and more of these minimally invasive, non-invasive type treatments to maintain beauty, maintain youth.
Yeah, and that's what I've been seeing in Michigan as well. And I remember actually the first time I saw injectable fillers, it was you and Dan, Dr. Yamini, doing them. And so it's amazing when that was, 12, 13 years ago, the first time I ever saw it. Now it's just so commonplace, and there's so many people that are benefiting from it. And I think it's a way that our field and our patients have really benefited just from technology.
Yes, for sure.
So that has then brought us now to the subject of the show today, and it's these minimally invasive lunchtime types of procedures. So there in Beverly Hills, do you think that people are asking or expecting something different than maybe people in other parts of the country when they come to see you? And I know you have a lot of people who fly in from all over the country to have procedures by you. Do they tell you that they're expecting something different from you than maybe from a plastic surgeon in Boise or in Des Moines?
Well, I think they all want the same results in the end. They all want to look good, they all want to feel good, and they all want to look their best. And a lot of them do come here, the Beverly Hills, Southern California, because it's a mecca to plastic surgery, it's cosmetic surgery especially. And I think, especially around here, the expectation is much higher than in other parts of the country, because this is where the hub of where it's all being done. This is all where the latest and greatest technologies and advancements are being done. And so when they come here, they expect more. They expect that result more often than, say, in other parts of the country.
Mm-hmm. Do you feel added pressure as a plastic surgeon out there? I mean, because, in the end, we trained at the same place. We trained very similarly, yet somebody may say, well, you're a Beverly Hills plastic surgeon, so can't you do it better than my Detroit plastic surgeon?
Well, I think,
ever say that?
Well, people do say similar things, but plastic surgeons, for the most part, are very good all across the country. Yeah. I think it's all about where they're specializing, where their specialty is. And when I'm out here, it's different because that's all I'm exposed to are these very so mostly, not all of them, but many are very demanding and with a much higher expectation because this is where it's at and this is where all the latest technologies are. And they want to, get the best result.
Well, and I think it's a credit to you and to Dr. Yamini that the fact that you guys have established such a successful practice really in the heart of Beverly Hills. I read a statistic once where they said that 1 out of every 500 people in Beverly Hills is a plastic surgeon. And so the competition
it's probably true. Or they do some sort of plastic surgery, yes.
Now, in my area, I think it's 1 out of every 20 or 40,000. So, the competition is very, very different out there. And for you guys to establish such a successful practice, really, I think, is a testament to the quality of your work, to the care that you give your patients. And I know you've had celebrity patients who've gone on TV, showing off your work and that. So, I give props to you in that it's a challenge. And I know of a lot of people who've headed out to Beverly Hills. They wanted to make it out there. And like actors who try to make it out in Beverly Hills and they can't and head back home, plastic surgeons do the same thing.
Exactly, yes.
Well, that leads us to some of these procedures we're doing. So as a Beverly Hills plastic surgeon, you have the added expectation to have better results with less downtime. Is that correct?
Yes, that's the whole point. And that's why a lot of these procedures we're going to discuss today, that's the point of this, is shorter healing, quicker back to their lifestyle. People don't have weeks to take off.
Exactly. Well, let's start with the first one. So the first one is called submental liposuction. I call it basically a weekend neck lift. So can you give our viewers, our listeners today, the scoop behind that procedure? And we do have a before and after photo that we'll show here as well.
That's perfect, yes. Well, around here, they're probably calling it more of lunchtime neck lift because you could potentially do it during your lunchtime. The procedure is quite straightforward. Most of these are done under a local anesthesia, which means the patient's never under a general anesthesia. They're never put completely to sleep. They get a little light sedation with, say, a Valium, a little bit of pain medicine. And then the areas that are treated, especially under the neck, would be anesthetized with a local anesthetic injection. That's probably the only portion of the procedure that's kind of uncomfortable because it stings a bit, it burns a little bit, but it's very short-lived. Then they're completely numb, and then the procedure continues. The next part of the procedure is then a few small incisions, usually one under the chin and sometimes just behind the earlobe, to access the fat just deep to the skin. Once they're anesthetized, then that fat is treated. I usually use an extra technology called smart liposuction, which is a type of laser that targets fat cells in addition to help tightening the tissues and even tightening some of the skin. So that's where you kind of get the neck lift part of it. And then the final step would be going in with a very small stainless steel cannula and literally suctioning or aspirating out all that liquefied fat and contouring the neck and even the jowls. I think this patient that we're showing is that part of her jowls on the side of her lower face were also contoured in. And you could see it's a substantial change. Those before and afters, that's only 1 month after her surgery. So she looked really good, relatively quick. And that's what majority of patients will look like. Even a week later, they'll look quite normal.
So you do find that the smart lipo, adding that laser heating, can really help with the skin tightening of this procedure.
Yeah, I think that's one of the advantages. I don't want to like oversell it on that. It does give you some tightening. I don't think it's for everybody. There's some people that come in and say, "Can't you do that laser there?" And some are kind of to the point where skin maybe is a little bit too loose. But for a lot of people, it really can help and give them a little extra benefit.
So is there an age in which, in general, you tell patients that, well, if you're at this age, it may not be enough. Maybe we need to proceed more towards an actual facelift?
Yeah, I don't base it on age. It's I have patients that could be 60 and their skin is great still and could be a great candidate for this. And then I have people that might be in their early 40s where the skin has already gotten laxed and it's loose and hanging, and it would require something a little bit more advanced, such as like a lower facelift or a more surgical type neck lift.
And what's the downtime with this? So they have the procedure done. They literally walk out of your office.
They leave the office, usually an hour and a half later.
That dressing on.
Yeah, there's usually a little head wrap that kind of goes around with a little compression under the chin. They can head home. I tell them to relax for the evening. Usually the next day, pretty much everybody, I have them take the dressing off and they can shower and wash and, put their makeup on or whatever. Rarely do they get bruised. And I tell them, for the most part, if you need to go out, you need to do things, take it all off, get your hair done, look great, go do your errands or whatever. And when you're home, or maybe seeing the privacy of your office or whatever, wear the band. I usually have them wear it for about 3 or 4 days, just to give them that a little extra support there. But after that, it's really, they actually look very, very normal.
Oh, that's great. So we do have the before and after photos that we're showing here. If you're listening on the podcast, go to my website, dryun.com, and we do have the photos there. Obviously, if you're watching, then you should be seeing them here on your screen. So that's great.
Yeah.
So
now
that's
just one more point on that. Just this patient, she's 45 and she had relatively good skin, so that's why she was a very, very good candidate for this type of procedure.
Yeah, I think it's an excellent result. I mean, I'd be proud of that if that was mine. All right, the next procedure is a procedure that I learned when I was out in Beverly Hills. I never actually heard of this procedure when I did my residency training, called the lip lift. And we do have a really dramatic before and after photo here that we're going to show. And I can't get results like this if I just use injections. So let's explain this procedure and if you can, what you see out of it and the types of patients that are candidates for it.
Yes, exactly. And I'm in the same boat. I never even heard of this until I came to Beverly Hills and was taught by one of the greatest. But he showed me this technique. Again, a local anesthesia takes about an hour. Carefully, incisions are placed right at the base of the nose, and sometimes I've actually modified that over the years, where now the incision's going more into the nose. So any resulting scars is hidden very, very well. But there's a small incision that's created along the base of the nose, a portion of the skin, and it's all determined on how long that lip is. Usually you start going beyond 15 millimeters or so, they start looking proportionally long on most people. Usually older patients are better candidates for this, because over the years, things have lengthened, things have stretched, there's less elasticity, and so the proportion of the upper lip just looks very long. So marks are made. They call it a bullhorn incision, whatever. There's different ways they call it, but there's carefully placed marks. Incisions are made to take out a portion of skin that's marked. Then some undermining is done under the skin down toward the muscle. The key step for this whole process is lifting the lip. So there's carefully placed sutures near the midline in the muscle and deeper skin that go to the base of the nose, that hard part at the bottom of the nose, they call the columella, or the lower septum, where the nasal spine meet. Those are the key stitches, because when those are in, and you tie them, it lifts the lip. It does not move the nose downward. So that's the key stitch. Then the rest is straightforward. It's a couple deep dissolvable stitches, and then a very thin, fine suture at the surface to approximate and line up the final skin edges.
So for the people who are listening, what he is describing is an upper lip lift. So as people get older, men and women get older, the upper lip itself, the skin part of it gets longer in some people, and the actual mucosa of the lip itself, the part of the mouth, gets thinner. And so if you go to the website, dryan.com, you can see the before and after. Very impressive of somebody. And it looks like she's had her lips injected.
Now,
but it's
here's another part of this step here with this particular patient is she wanted more fullness. Now, she has had other surgeries in the past, other facial surgeries, but she was unhappy about this look around her mouth. So part of this procedure also, again, a local procedure, is harvesting a little fat from somewhere, processing, and then re-injecting the fat. And this is just fat injection in her lip. And it really held up very, very nice. Yeah. And I think this lasted years and years afterwards. So, and it further augmented and improved the shape of the lip.
Yeah, it's a gorgeous result. Now, my concern when I have performed these surgeries, obviously, is the scar. So this does create a permanent scar. Do you have an age range that you do it on? I mean, I do find that older people tend to scar with a much thinner, less visible scar than younger people. Do you limit this in people who are older, or have you performed it in younger people as well?
I have a few younger people, maybe in their late 20s, early 30s, where you just look at the lip. It's very, very thin. It is very long. And it's just a genetic thing for them.
Yeah.
Yes, and I definitely consult with them, and I stress the fact that, yes, there is a scar, usually heals very, very well. But they have to understand that it is somewhat of a permanence there in terms of the scar. So that's why in more recently, I've been modifying that incision so it's slightly higher into the nose, and it really, and some people, you can't see it. You really can't see the scar. You really got to go look for it.
And this is a very impressive result. So obviously, if you're watching, you should see it on the screen. If not, take a look at the website so you can see this impressive before and after. All right, well, let's proceed to an upper eyelid lift or a blepharoplasty. Now, this is a surgery that I perform all the time. I do typically perform this in the operating room. For me, it takes about an hour and 15 minutes. I usually do it under a sedation, sometimes under a general anesthesia, depending on what the patient wants. But you're doing this in your office under a local anesthetic, and the people walk out afterwards.
Absolutely, yeah. And some people, they'll drive home. I mean, some don't even want the little Valium or Xanax I give them. They're just like, no, it's not a big deal. And again, the only discomfort is that initial little injection that stings a bit. It's completely numb. You follow the marks. You take a little bit of that extra skin off, tighten that muscle a little deeper, and they walk out of here an hour later. Yeah. So it's a quite easy procedure to perform. Usually the stitches that are put in stay 5 to 7 days. They're out. There's a little bit of swelling, but really they can get back to doing regular things even the next day.
Okay. How long do you ask them to stop exercising for?
Well, that's the key thing. Minimum, I usually tell them 2 weeks, sometimes a little bit longer, 3 weeks. I think the exercising can cause additional swelling and potentially, even early on, potentially bleeding. So we want to minimize any of those potential problems.
Yeah, and that's what I typically recommend to my patients as well. The one question I have, I think, in doing a blepharoplasty that I've done a few in my office, not many. I only do the upper eyelids in the office. Do you do the lower eyelids in your office?
I have done some lower eyelids. It's a little more challenging.
Yeah.
If I'm going after, say, fat pads, big fat pads, then I may opt general anesthesia in the regular operating room. But if it's more muscle tightening on the lower eyelid, skin removal, skin tightening, and even in this particular patient that we're showing, is this patient also had some fat grafting through the cheek a little bit to help kind of boost that and give them a little more fullness, that more youthful look. But most patients will tolerate the lower eyelid surgery also. It's just it's a little more tedious, a little more careful.
And do you remove fat in the upper eyelids when you do the surgery in the office?
I rarely ever remove fat in the upper eyelids. The trend has been over the years is that try to leave more fat, don't take as much out, because they found that as people age, you tend to get more and more hollowed. If a lot of fat's been taken out, as they get much older, they start looking very skeletonized around the eyes. So, and then that's when we come in and we're doing fillers, we're putting fat grafting in to kind of restore that youthful kind of plumpness.
Well, that's great. And I think the results obviously speak for themselves here.
Yeah.
Oh, no, I know that this next surgery is one of your favorites because when I was out there, 13 years ago, you did a lot of these otoplasties or ear pinbacks. Now, I don't do a lot of them. This is not, I heard there was a marketer, plastic surgery marketer, who once told me that otoplasty is something that they don't even make brochures for because there's not enough of these to support a practice. Yet, I know this is one of the things that you've always enjoyed doing in your practice. So, and we've got some good before and after photos here. Now, these were also done in the office under a local anesthetic?
That's correct. Yeah, I mean, I think I really got intrigued with this in my training. When I was at George Washington University, almost half my time in plastic surgery training was spent at Children's Hospital, right there in Washington, D.C. And we did tons and tons of plastic surgery on children and all kinds of deformities. And prominent ears was a very common thing. What's interesting about ears is usually by age 6, they're like 90% grown.
Yeah. So
what we would do back then is, we'd be operating on these children that are 5, 6 years old to help them kind of avoid the stigma and the bullying from peers and stuff at school of having big ears, the big Dumbo ears. So it really can help somebody that looks a little, disproportionate, a little abnormal with these big ears to looking like a very normal young kid. And so that was the reason why they would do these surgeries at a young age. But most of the ones I do out here are for adults who've been living with this all their life. And finally they said, I need to do something about it.
So the procedure, how long does it take in the office?
It depends. I mean, some of the more simpler ones where it's some stitching, slightly reshaping the cartilage, maybe removing a little bit of cartilage, those can each take about an hour per ear. So I would say 2 hours would be on the shorter side, maybe more like 3 hours if it becomes more and more difficult with treating other areas.
Okay, and then afterwards, I'm assuming they wear what we call a turban, where their head is completely wrapped.
Yeah.
And how long do you keep that dressing on for?
Yeah, and that's the other thing too. With these patients, it's similar dressing that we put for the neck procedure.
Okay.
Instead of putting a gauze here, we're putting a gauze around the ear.
Yeah.
They wear it home. The next day, I usually have them come back. I'll take all the dressings off. And if it wasn't a really, say, intense type of surgery where I'm doing multiple steps, I'll tell them you don't even have to wear it. During the day, if they have longer hair, they can wear their hair down. You would never be able to tell that they even had surgery the day before. They can do the routine things. The only thing is at night, I have them wear a head wrap, a headband, maybe a winter kind of wool cap to hold the ears in a little bit while they sleep. Because sometimes if you're moving around, if you pull on it too hard,
to pull your ear over and
you pop a stitch and then you're back in getting another stitch or two. So I have them be really, really careful with that, usually for about 4 weeks, wearing some kind of band or protection just at night.
Yeah.
During the day, whatever. And they actually look very normal even the next day.
And this is a great result that you've had. I mean, it looks very natural. I find it interesting when I do otoplasty. I find it very similar to when I do male breast reduction, is that the patients don't seem to want what we would consider a quote-unquote normal result. So, for example, if they have their ears pinned back, they don't want it at the average distance that we measure scientifically. They want it plastered to the side of their head. If I do a breast reduction on a male, they don't want their chest to look like any other male. They want their chest to be flat. They don't want any breast tissue left. Do you find the same thing in your practice?
I think, with a lot of these, because it's their whole life, that's been a focus of their face, and every time they look in the mirror, they see these ears, and just setting it back a little bit, it's not enough. They'll come back and say it needs more. And so a lot of them do want a very significant change. And that's when they're happy. But I try not to go too much, because I've seen some people that have been overdone by other surgeons where they're really almost stuck to the side of the head, and that could be a potentially a difficult situation.
Yeah, and there's another thing too that we know about called the barbell deformity, where part of it is back, but the other parts are not. So it definitely, It is definitely a surgery that takes a ton of, I think, artistic skill and a lot of vision. And that's why I've always been impressed with your otoplasties, your ear pinbacks, because you've always spent that time. And we've operated together, and I've seen you do these. You spend a lot of time making sure that it's as perfect as can be.
Yeah, I love doing these. They're just fun for me. I just love doing them.
I see. You find them fun. I find them tortuous. So I'm glad that one of us likes to do it. All right, another one that is not one of my favorite operations, but I do it quite often, is rhinoplasty, and that's nose job surgery. And we both trained with Dr. Ellen Bogan, who did tons of rhinoplasty surgeries, a lot of revisions, fix-ups of nose jobs gone bad. He actually was the one that taught me to be able to tell if somebody has had their nose done. So it's interesting, but you and I could probably look at celebrities' photos, and without even knowing their medical history, would be able to tell probably within 90% accuracy of whether this celebrity has had their nose done or not.
Exactly. Yeah, there's some telltale signs of that.
And you're doing these in the office now too.
Yeah. Now it depends. Again, like in this particular patient, he just wanted some changes to the tip of his nose. It was asymmetric. The ala was dropping. It was a little bit thick, and he didn't want any major changes. But with just the tip, it's very easy. A few injections, you numb that up, completely numb. They could lay there, and a lot of them are very comfortable with this. Even though I'm working on their nose, they're breathing on their own. There's almost no bleeding. And then with a few small incisions, I could go in there and manipulate the cartilage, remove cartilage or however, and make the adjustments with suturing, and really make a nice change with a procedure that might take an hour and no general anesthesia.
And does this gentleman have any visible scars, or are they all hidden inside the nostrils?
They're pretty much inside, so you really don't see anything that's obvious on the outside. And he was so happy about this. He's like, I that's the one thing he said. I've been to other doctors, and they want to bring me to the operating room. They want to take my whole nose apart. They want to do this and that and the other thing. And he's like, I just want to get this little bit changed. Can we do that? And I said, yeah, we could do that. So I think that's where, there's a difference, especially with these people. Like this particular person is developing a TV show, like a talk show. And so he didn't have time to be bandaged up for weeks and weeks and weeks.
Yeah, and if we do rhinoplasties, a lot of doctors will break the bones of the nose to reset them. They do septoplasties. They alter the inside of the nose. They take cartilage from the ear and put that in the nose. And I do agree with you. I think in a lot of cases that in rhinoplasty, less is more. And that's what I do with my patients as well, is sometimes they just want little tweaks, and to go through and completely reconstruct the nose is overkill for a lot of them.
Yes, exactly. And I think that's one thing I've learned too with training out here, like we did with Dr. Ellen Bogan, is that, that whole closed technique, small incision, just make the incision just big enough to get what you need to get done and get out. This way they heal quicker, there's less swelling, they look better quicker. So back to the routine. So
for you who are listening and who are watching, is describing what's the difference between an open and a closed rhinoplasty. And a closed rhinoplasty is when there's a couple of small incisions inside the nostrils, and virtually the entire operation is done through those incisions. So there's minimal swelling compared to the other technique. People heal faster, and usually no visible scars. The open technique takes those same incisions, but then it actually connects it across the nose, so you can literally flip the skin up off the tip of the nose, and you can see more. But by doing that, the risk of complications may be higher. You obviously have more scars, and there's going to be longer swelling, longer lasting swelling afterwards.
Yeah, that's correct.
Yeah. So do you have them wear a splint, or do they have anything inside their nose?
No. Usually for these, there's no packing. I mean, if it's something that requires packing, then it's something I'd probably be doing in the operating room. But these, usually no packing. Rarely, sometimes I'll just put some tapes on for a little support. No splint. And sometimes nothing. They just leave, and I tell them, come back in a week and we'll just take a look. But most people are fine with it. Yeah, and the results speak for themselves. So if you're watching, obviously you can see the results here. If you're listening on the podcast, the audio podcast, check out my website, dryun.com. We'll have on the podcast page for this episode
the before and after photos for you to check out. Well, I always ask my guests at the end of the show a piece of advice. So if you were to give one of our listeners, one of our viewers, a piece of advice on how they can look, live, and be better in their life, what would Dr. Steve Svehlak, Beverly Hills board-certified plastic surgeon, say?
Well, I could say, oh, I'm a plastic surgeon in Beverly Hills, come in and get plastic surgery, but no,
You're not
no, I'm not that type. So in reality, what I've learned over the years, we are our own worst critic. We are too hard on ourselves. And what I like to think about is like, do you ever go back and think and look at, say, an old photo of yourself from, say, 10 years ago and think, wow, I looked pretty great. I wish I knew that then. And so I think that's something you have to think about and say, well, let's think about how we would kind of reset our thinking today and say, think of yourself, say, 20 years from now, and you're looking back and how I look right now. And I think the big thing is, you'd say, wow, I look pretty great.
Yeah.
And one thing you could do moving forward is say, I look great now, and moving forward, I'm going to take better care of myself.
Yep.
And so you are only yourself, and, looking and feeling better now is going to just help you to the future.
And I think that's great advice. That's advice that I sometimes give my patients as well. I mean, I see people that I'm sure you do too, that they walk in and they look amazing. And anybody who is their age would say, wow, I would love to look as good as that person does, as she does, or as he does. Yet the person doesn't necessarily feel that way. And it's hard for us to try to convince them, look, you look so great, you're healthy, take care of yourself, appreciate the now.
Exactly.
And I think that's amazing advice I try to give to our patients. And sometimes my patients listen, sometimes they don't, but it's good to say it. And in my opinion, I mean, it's a blessing to get older no matter what, because there's the alternative, which none of us want. But as we get older, hey, you know what? If you have fun fighting off the aging process, then why not?
Yeah, exactly.
Well, thank you so much for coming on the show. Dr. Steven Svehlak is a board-certified plastic surgeon. He's got a practice in Beverly Hills, California. His website is www.sunsetcosmeticsurgery.com, sunsetcosmeticsurgery.com. I give him my absolute highest recommendation. If I were to have plastic surgery, I don't need anything, but if I were to have something, you'd be the guy probably that I would go to, because we've operated together, we have had drinks together, we've had dinner together countless times. I went to your wedding, which was probably the most beautiful setting and wedding that I have ever been to.
Thank you very much.
And I'm so happy that you're doing so well out in Beverly Hills without me.
Well, thank you for having me on your show. Yes, you look great. You don't need anything at this point, but we're all going to get a little older. So, but thank you very much for giving me this opportunity to be on your show and speak about some of the things I do out here.
Thank you. So I'm Dr. Anthony Yoon. This is Look, Live, and Be Better. We'll see you next time. Thank you very much. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock, and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoon.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.